Hi guys, so let's start with the question of the day. So the question goes like, a woman presents to psychiatry OPD with complaints of progressive memory loss and difficulty in performing daily tasks. Her family reports that she repeats questions frequently. On examination, patient demonstrates impaired recent memory and executive function, but her memory and sensory functions are intact. Based on the clinical presentation, which of the following drug is used for patient's condition? A. Memantamine, B. Donepezil, C. Levodopa, D. Lorazepam. So this is a question of Alzheimer's disease. What is Alzheimer's disease? First you should know that it is progressive. That means it keeps on progressing. Progressive neurodegenerative disorder which is characterized by memory loss, cognitive decline and changes in behavior and personality. So to know the symptoms of Alzheimer's disease, I used to learn it by 4 A's. It's a very common mnemonic. Amnesia. What is amnesia? It means inability to remember things. Aphasia. Aphasia means there is some language disorder. He is not able to speak properly. C. Apraxia. Apraxia means motor problem. He is not able to do his daily task like dressing up and combing. 4. Anognosia. That patient is unaware of his or her neurological deficit. There's absence of insight, that he is not aware that he is sick and he forgets things. So these are the 4 A's. Very important. So what you do for Alzheimer's disease, we do a mini mental state examination in which there is a maximum score of 30. So if the screening cutoff that is less than 24 means that the patient has Alzheimer's disease, then we can divide it on the basis of mild, moderate or severe disease. So this is a PYQ, very important PYQ. What are the biochemical changes in dementia? First, there are 2 A's which decline. First A is acetylcholine. Acetylcholine is declined. Nucleus basalis of Maynard is affected. This is also PYQ. Second, noradrenaline decreases. Noradrenaline is released from locus coeruleus and there is increased levels of glutamate. Glutamate is an excitatory neurotransmitter in a brain. So for treatment of for treatment of dementia or Alzheimer's disease, first as the acetylcholine is decreasing, we have to increase the levels of acetylcholine. So we give acetylcholine esterase inhibitors. There are 3 of them, that is donepezil, rivastigmine or galantamine. So in pharma I used to learn by just knowing the starting of the names, because we have to learn very quickly. So I used to learn like Riva, Dana, Gala. So donepezil, rivastigmine and galantamine. By this I know these are 3 drugs which are acetylcholine esterase inhibitors. These are given. So some important points. Donepezil, there's 1 here, so you give it OD, that is only once a day. Rivastigmine, this is a very important question. This is a PYQ INI November 2023. Rivastigmine, it is used as a dermal patch. So the question was given like a patient, he forgets to take his medication, so which of the following can be given as a dermal patch? So the answer is rivastigmine. And the third is galantamine. Tacrine was also a acetylcholine esterase inhibitor, but it has now been not used. Why? Because it is a hepatotoxic drug. So these are the first line drugs for Alzheimer's disease. Second, again a PYQ. What is the NMDA antagonist? As the glutamate is increasing, we have to decrease glutamate. So memantamine. It is used for moderate to severe dementia. Now some monoclonal antibodies are also introduced. Lecanemab and adacanumab. So why nu? Mab means monoclonal antibodies and nu is for neurons, that it binds to the A beta microfibrils. So nu is for neurons. Leca, adu. So you can learn the monoclonal antibodies. Now the fourth and monoclonal antibody, it was introduced in July 2024. It's a new drug. So very important for INICT. INICT people will ask you a new drug. So it is donanemab or also known as Kinsula. So this is the photo. So It should be initiated in patients with mild cognitive impairment or mild dementia stage of disease. It is given IV infusion every 4 weeks. So these are some important drugs which we give for Alzheimer's disease. So Alzheimer's disease is an important topic. You should revise it from both psychiatry and pharma. Thank you guys. See you tomorrow with another question.